Hepatitis A. It is an waterborne disease, communicable disease. Look at this picture, shows that signs and symptoms, and hepatitis A virus. A detail going on. Introduction. Hepatitis A is a highly contagious liver infection caused by the hepatitis A virus, HAV. It is usually transmitted through ingestion of contaminated food or water and can cause inflammation of the liver. While it generally does not lead to chronic liver disease, it can cause acute symptoms, and the disease ranges from mild to severe. Definition. Hepatitis A is a contagious liver infection caused by the hepatitis A virus, primarily transmitted through the consumption of contaminated food or water. It causes liver inflammation, leading to symptoms such as jaundice, fatigue, abdominal pain, and nausea. Types. Hepatitis A does not have subtype like hepatitis B or C, as it is caused solely by the HAV. The virus itself has only one major strain, although individual cases can range from mild to severe. Causes. The main cause of hepatitis A is infection with the hepatitis A virus, which is member of the picornavirus family. The virus is typically ingested through 1. Contaminated food or water, 2. Close contact with an infected person, 3. Poor sanitation and hygiene. Transmission. Hepatitis A is primarily transmitted through the fecal or oral route. This occurs when a person consumes food or drinks contaminated with feces from an infected individual. Key methods of transmission include 1. Consuming contaminated water or food, 2. Direct contact with an infected person, 3. Traveling to areas with poor sanitation, 4. Injecting drugs during shared needles. Risk factors. 1. Traveling to or living in countries with high rates of hepatitis A, 2. Living in unsanitary conditions, 3. Close contact with someone who has hepatitis A. For eating raw or uncooked shellfish from contaminated water, 5. Drugs use shared needles. 6. Working in areas related to wastewater management or child care centers. Complications. Although hepatitis A usually resolve on its own, certain complications may arise. 1. Fulminant hepatitis, a rare but life-threatening acute liver failure, especially in older adults or those with pre-existing liver conditions. 3. Prolonged cholestasis, where bile flow from the liver is slower or blocked. 4. Relapsing hepatitis, the infection and symptoms can return after an apparent recovery. 5. Joint pain, fatigue and jaundice lasting for months. Pathophysiology. After entering the body, the HIV replicates in the liver's hepatocytes, leading to liver inflammation. The immune system's response to the virus causes the destruction of infected liver cells, leading to liver dysfunction. This inflammation reduces the liver ability to carry out its normal metabolic functions, including bilirubin clearance, with results in jaundice. The pathophysiology of hepatitis A involves several key steps, starting from viral entry to liver inflammation. Here is step by step breakdown. 1. Ingestion of HIV via contaminated food or water. 2. Viral absorption in the intestines. 3. Viremia, spread of virus through the bloodstream. 4. Infection of hepatocytes, virus targets liver cells. 5. Immunoresponse, leading to liver inflammation and cell destruction. 6. Liver inflammation causes hepatocellular damage. 7. Impaired bilirubin metabolism, leading to jaundice and other symptoms. 8. Systemic symptoms arise from liver dysfunction. 9. Viral shedding in stool continues the spread of infection. 10. Immunoclearance and recovery with lifelong immunity. Signs and symptoms. 1. Fatigue. 2. Nausea and vomiting. 3. Abdominal pain, especially near the liver. 4. Loss of appetite. 5. Low grade fever. 6. Dark urine. 7. Pale stools. 8. Joint pain, 9. Jaundice, yellowing of the skin and eyes. 10. Itching. Diagnosis: 1. Serological testing for specific antibodies anti-HIV IgM in the blood is the primary method to diagnosis. Hepatitis A. 2. Liver function test. Elevated liver enzymes, especially ALT and AST, can indicate liver inflammation. 3. Physical exam. Jaundice and liver tenderness may be noted. Nursing diagnosis. 1. Risk for infection related to the contagious nature of hepatitis A. 2. Imbalanced nutrition, less than body requirements due to nausea, vomiting, and loss of appetite. 3. Fatigue related to the disease processes. 4. Risk for fluid volume deficit due to vomiting and diarrhea. 5. Altered skin integrity related to itching from jaundice. 6. Anxiety related to diagnosis of hepatitis A and possible complications. Management. 1. Systemic treatment, managing nausea, vomiting, and fatigue. 2. Education, teach the patient about hygiene and food safety measures to prevent spreading the virus. 3. Infection control, proper hand washing, especially in group settings. Treatment. There is no specific antiviral treatment for hepatitis A, but management focuses on relieving symptoms and supporting liver function. 1. Rest, adequate rest in crucial to recover from fatigue. 2. Hydration, replace fluid lost due to vomiting and diarrhea. 3. Nutritional support, light, frequent meals are recommended. 4. Avoidance of alcohol, it can exacerbate liver damage. 5. Hospitalization, rarely in severe cases such as fulminant hepatitis. Psychosocial medicine. Patients diagnosed with hepatitis A may experience 1. Anxiety and fear due to the diagnosis and potential complications. 2. Social isolation due to the contagious nature of disease. 3. Emotional support, counseling and education about the disease can help reduce anxiety. Prevention. 1. Vaccination, The hepatitis A vaccine is highly effective and recommended for those at risk. Example, travelers, people in high risk occupations. To good hygiene, hand washing, especially after using the toilet or handling food. 3. Safe food practices. Avoiding raw or undercooked shellfish and ensuring proper food handling. 4. Sanitation. Improved sanitation in areas with poor hygiene can reduce transmission. In conclusion, hepatitis A is a preventable and treatable disease, primarily spread through contaminated food and water. Vaccination and proper hygiene can effectively prevent its transmission. With early diagnosis and supportive care, most individuals recover fully, though complication can occur in vulnerable populations such as the elderly or those with pre-existing liver conditions. Educating patients and communities about preventive measures is key to reducing the global burden of hepatitis A. Thank you. Have a wonderful day.